Dr. Rose with Natural Transplants, and we're following up with Eureka. How are you today?
I am doing well.
Wonderful. And we just removed the sutures, correct?
Correct.
How'd that feel?
Wasn't too bad. Just the areas where the knots, I guess, was tied on the ends were the most painful, but the rest of it was fine.
Yes, and now you're free. You actually can go back to your normal routine, showering, and start resuming normal life again. Not too bad, right? It's been
Not too bad, because I can wash it. It's much easier to wash when you don't have those things in the way worrying about if you're going to knock them out of place or mess it up or cause it to bleed or something like that. So,
well, you did fantastic. There was no evidence of any of that. You took care of it beautifully. And in a minute, I'm just going to show the suture line. Okay. And how is just the whole healing process for you over the past 10 days?
You know, sleeping has been a little rough because it's just trying to get into a good position because I had two sutures on both sides and they were both kind of tender. It was just kind of hard to find that comfortable spot to lay in. But the neck pillow does help a lot. So I've been sleeping on my lazy boy couch for the most part for the last 10 days. So that helps a lot too, to have one of those chairs where you can actually like recline and still sleep and not have to worry about laying completely flat. So it does help. So I just take an ibuprofen and I'm able to get some sleep.
Awesome. Awesome. Yeah. And if you don't have a lazy boy, you could just prop a few pillows up and the neck pillow. But that does, that's a nicety. Awesome. Well, like I said, you did a great job taking care of it. And now we just watch your hair grow.
Yes, I already see the little fuzzies growing in. I'm excited. I'm like, I can't wait to see the front area especially.
Definitely. And I'm loving that hairline still. It's going to be great. And Dr. Rose here, we're just going to be showing a little bit of the suture line now. We do have to shave the area, but all of these hairs are going to grow back. You just want to look and see this fine little line here. Put my comb right there is what the suture line will ultimately heal to be. And like I said, these hairs are going to grow back in the next 6 to 8 weeks or so back here. So it looks wonderful. You did a great job taking care of it. And that's pretty much ideal and what we would expect at this point in time. So you're on your way. We're just showing you here Eureka's hairline progress, and this is about 10 days post-surgery. And you can see most of the grafts have actually started to fall out here, but you can see the remnants of where we transplanted. We covered a lot of area for her. And of course, we're excited about this hairline. All of these baby hairs will start to grow. The grafts take anywhere from 4 to 12 months to mature. But these little baby hairs that we shaved, those are going to come back in the next 4 to 6 weeks or so. So not too bad of a process, and you can wear a silk wrap or head covering or wigs. So really a small kind of price to pay for future hair. Awesome, looking great, Eureka. And I'm just showing here, look how cute this is. She basically is wearing, this is all silk.
Yes.
And safe to wear this from 1 to 2 days after the surgery while the grafts are falling out and even beyond, just to kind of cover it up. And she looks beautiful and fashionable.
Call us now, 844-327-4247, and ask about our Hue and Hue Plus procedures, which move more hair than ever before. Hope to hear from you soon.